Vitamin D deficiency is a widespread health concern that affects millions of people worldwide, particularly in regions with limited sun exposure. This essential vitamin plays a crucial role in numerous bodily functions, from maintaining strong bones to supporting immune function and even regulating mood. Despite its significance, many people do not get enough vitamin D due to lifestyle factors, dietary limitations, or medical conditions. Below, we delve into the most common symptoms of vitamin D deficiency, exploring how it impacts different aspects of health and why it is crucial to maintain optimal levels. 10. Bleeding gums, a lesser-known symptom of vitamin D deficiency. Bleeding gums are often associated with poor dental hygiene or gum disease, but did you know that low vitamin D levels can also contribute to this problem? Vitamin D is crucial for oral health because it promotes calcium absorption, helping to maintain strong teeth and jawbones, regulates immune function, protecting the gums from bacterial infections, reduces inflammation, preventing gum disease, gingivitis. When your body is deficient in vitamin D, it struggles to produce enough antimicrobial proteins, making your gums more prone to infections and bleeding, especially when brushing or flossing. A study published in the Journal of Periodontology found that people with low vitamin D levels were more likely to suffer from gum inflammation and bleeding. Additionally, a deficiency in vitamin D has been linked to an increased risk of periodontal disease, a severe gum infection that can lead to tooth loss if left untreated. If you frequently experience bleeding gums, gum sensitivity, or persistent bad breath, consider increasing vitamin D intake through food, supplements, and sunlight exposure. Maintaining good oral hygiene, brushing and flossing daily to remove plaque buildup. Eating a balanced diet rich in calcium, magnesium, and vitamin K2, all of which support strong bones and teeth. Bleeding gums can be a warning sign of vitamin D deficiency, as this essential nutrient helps protect against inflammation and gum disease. Ensuring adequate vitamin D intake may reduce gum sensitivity and improve oral health over time. 9. Mouth ulcers, a hidden sign of vitamin D deficiency. Mouth ulcers, commonly known as canker sores, are small, painful lesions that develop on the inside of the mouth, lips, or tongue. While they are often linked to stress, minor injuries, or food sensitivities, a deficiency in vitamin D may also contribute to their recurrence and severity. Vitamin D plays a crucial role in maintaining healthy teeth, gums, and oral tissues by regulating calcium and phosphorus levels, essential for strong teeth and bones, supporting immune function, helping the body fight off oral infections, reducing inflammation in gum tissues, preventing gum disease and sores. When vitamin D levels are too low, the immune system may become weakened, making it easier for bacteria and viruses to cause mouth ulcers. Additionally, low vitamin D levels may slow down the healing process, causing ulcers to last longer and become more painful. A study published in Oral Diseases found that people with recurrent canker sores often had significantly lower vitamin D levels compared to those without ulcers. Another study in the Journal of Clinical Periodontology suggested that vitamin D deficiency is linked to an increased risk of gum inflammation and bleeding. If you experience frequent mouth ulcers, gum bleeding, or slow healing of oral wounds, you may benefit from increasing your vitamin D intake through vitamin D-rich foods, dairy products, fatty fish, and fortified cereals. Sun exposure, at least 15 to 30 minutes of sunlight daily. Vitamin D supplements, if dietary intake and sun exposure are insufficient. If you frequently suffer from painful mouth ulcers or gum issues, it may be time to check your vitamin D levels, as deficiency can weaken oral immunity and slow down healing. 8. Poor vision, vitamin D's role in eye health. Vitamin D does more than just strengthen bones. It also plays a critical role in maintaining good vision and overall eye health. Research has shown that low vitamin D levels may contribute to poor eyesight, increased light sensitivity, and even age-related eye diseases. Vitamin D helps regulate calcium homeostasis, which is essential not only for bone health but also for eye function. Calcium plays a vital role in transmitting nerve signals from the retina to the brain, allowing us to process visual images clearly. When vitamin D levels are low, this process can be impaired, leading to symptoms such as increased sensitivity to bright lights, difficulty adjusting to changes in lighting, e.g., moving from a bright environment to a dark room, eye fatigue and strain, especially after long periods of screen time. One of the most significant risks associated with chronic vitamin D deficiency is an increased likelihood of developing age-related macular degeneration, AMD, the leading cause of blindness in older adults. A recent study found that people with low vitamin D levels were nearly twice as likely to have poor vision compared to those with normal levels. This is because vitamin D helps reduce inflammation in the retina, protecting it from degenerative diseases that cause blindness over time. To support long-term eye health, it's essential to maintain adequate vitamin D levels. This can be achieved through regular sun exposure without overuse of sunglasses indoors, vitamin D-rich foods like fatty fish, egg yolks, and fortified dairy products, supplements if natural intake is insufficient. If you experience frequent eye strain, light sensitivity, or blurry vision, checking your vitamin D levels may help you understand whether nutritional deficiencies are contributing to your symptoms. 7. Brittle hair. The link between vitamin D and hair health. Hair health is often a reflection of overall nutritional status, and vitamin D plays a crucial role in maintaining strong, healthy hair growth. A deficiency in this essential nutrient can lead to brittle, thinning hair, slow hair growth, and even excessive shedding. Vitamin D is not just important for bones and muscles, it is essential for hair follicle health. Hair follicles go through different phases of growth, and vitamin D helps regulate these cycles by activating keratinocytes, the cells responsible for producing keratin, the primary protein that makes up hair, skin, and nails. When vitamin D levels are low, hair follicle regeneration slows down, leading to weaker strands and increased hair breakage. Research has shown that people with chronic hair thinning or hair loss disorders, such as alopecia areata, often have low vitamin D levels. A study published in the Journal of Cosmetic Dermatology found that women with lower vitamin D levels had significantly more brittle and dry hair than those with adequate levels. Another study linked severe vitamin D deficiency to conditions like alopecia, suggesting that ensuring adequate vitamin D intake may help prevent excessive hair thinning and breakage. If you notice brittle, dry, or thinning hair, it may be time to check your vitamin D levels. However, vitamin D is just one piece of the puzzle. Other important nutrients like biotin, vitamin B7, iron, vitamin A, and omega-3 fatty acids also contribute to hair health. Maintaining optimal vitamin D levels through sunlight exposure, diet, or supplementation can help support hair growth, strengthen hair strands, and reduce brittleness over time. 6. Muscle spasms and weakness. The impact of vitamin D deficiency on muscular health. One of the most common yet overlooked symptoms of vitamin D deficiency is muscle spasms, cramps, and weakness. These symptoms arise because vitamin D plays a crucial role in muscle function, helping regulate calcium and phosphorus levels, which are essential for proper muscle contractions. However, the effects of vitamin D deficiency on muscle health go beyond just occasional cramps. Severe deficiencies can lead to profound muscle weakness, chronic pain, and even temporary paralysis in extreme cases. Vitamin D is also closely linked to neuromuscular health and has been extensively studied in relation to multiple sclerosis, MS, a chronic autoimmune disease that affects the brain and spinal cord. MS occurs when the immune system mistakenly attacks the protective covering of nerve fibers, myelin, leading to inflammation, nerve damage, and progressive muscle weakness. The relationship between vitamin D levels and MS was first identified in 1976 When Danish researchers observed that people living in regions with less sunlight exposure had a significantly higher risk of developing MS compared to those living in sunnier climates. Since then, numerous studies have reinforced this connection, showing that people with low vitamin D levels are at a higher risk of developing MS than those with adequate levels. If you experience frequent muscle cramps, persistent weakness, or unexplained muscle fatigue, it may be a sign that your body lacks sufficient vitamin D. However, vitamin D does not work alone. It needs other key nutrients like magnesium, vitamin K, and calcium for optimal absorption and effectiveness. Ensuring that you get enough sunlight exposure, eat vitamin D-rich foods, or take high-quality supplements can support healthy muscle function and potentially reduce the risk of conditions like MS. 5. Dry skin and skin disorders. How vitamin D affects your skin health. One of the lesser-known symptoms of vitamin D deficiency is dry and flaky skin. This is because vitamin D is involved in skin cell production, hydration, and repair. Several skin conditions have been linked to low vitamin D levels, including eczema, atopic dermatitis, a condition that causes dry, itchy, and inflamed skin; psoriasis, an autoimmune skin disorder characterized by scaly red patches; ichthyosis, a disorder that results in thickened, rough, and scaly skin, making it appear excessively dry. If you struggle with chronic dry skin, itchiness, or irritation, increasing your vitamin D intake may help improve skin hydration and overall texture. 4. Weak and brittle bones, the silent danger of vitamin D deficiency. Vitamin D plays a vital role in calcium and phosphorus absorption, two minerals essential for maintaining strong and healthy bones. Without enough vitamin D, the body struggles to absorb calcium from food, leading to bone demineralization. Long-term vitamin D deficiency can result in osteoporosis, a condition that causes bones to become brittle, increasing the risk of fractures; rickets, a rare but severe disorder in children that leads to weak and deformed bones, increased risk of fractures, especially in older adults, whose bone density naturally decreases with age. If you suffer from frequent fractures, back pain, or joint stiffness, consider getting your bone density checked and ensuring your vitamin D levels are sufficient. 3. Low energy levels and fatigue. The hidden cause of constant tiredness. Chronic fatigue and low energy levels can have multiple causes, including poor diet, lack of sleep, and stress. However, one often overlooked factor is vitamin D deficiency. Vitamin D is essential for muscle function, oxygen circulation, and cellular energy production. Without adequate levels, many people experience persistent fatigue, daytime drowsiness, and even muscle weakness, affecting their ability to perform daily tasks effectively. This deficiency may be even more severe for people with autoimmune conditions such as multiple sclerosis, MS, and fibromyalgia, where energy levels are already compromised. If you frequently feel exhausted despite getting enough sleep and eating well, a vitamin D deficiency test may help determine whether supplementation is necessary. 2. Mood swings and depression, the link between vitamin D and mental health. Vitamin D functions as more than just a vitamin. It acts as a steroid hormone that influences over 200 genes in the body, including those involved in brain function and mood regulation. Because of this, mood swings and even depression are common symptoms of vitamin D deficiency. Scientists have linked low vitamin D levels to seasonal affective disorder, SAD, a form of depression that occurs during the winter months when there is reduced sunlight. This is especially true for people living in high-latitude regions where daylight hours are significantly shorter in winter. Women are particularly vulnerable to mood disturbances caused by vitamin D deficiency, as hormonal fluctuations, such as those during menstruation, pregnancy, and menopause, can exacerbate symptoms. If you experience persistent mood swings, anxiety, or depression, it may be beneficial to check your vitamin D levels, as supplementation could help improve your overall well-being. 1. Weakened immune system. Why vitamin D is crucial for fighting infections. Vitamin D is often referred to as the sunshine vitamin because the body naturally produces it when exposed to sunlight. The ultraviolet, UV rays from the sun convert cholesterol in the skin into vitamin D, which is then activated by the liver and kidneys for use in the body. However, many individuals do not get enough sun exposure due to spending excessive time indoors, living in regions with long winters, or using sunscreen, which blocks UV rays from penetrating the skin. Older adults are particularly at risk since the skin's ability to produce vitamin D decreases with age. One of the most significant consequences of vitamin D deficiency is a weakened immune system. This vitamin plays a pivotal role in activating T cells, which help the body fight infections. Without enough vitamin D, the immune response is compromised, making individuals more susceptible to colds, flu, and other infections. While a weakened immune system may not always indicate vitamin D deficiency, experiencing frequent illnesses or slow recovery from infections could be a sign that your body lacks this essential nutrient. Vitamin D deficiency is a widespread issue, and its causes can vary depending on lifestyle, diet, and environmental factors. Some of the most common reasons people develop low vitamin D levels include: 1. Lack of sunlight exposure. The primary source of vitamin D for the body is sunlight. When UVB rays hit the skin, they trigger the production of vitamin D3, the active form of the vitamin. However, several factors can limit sunlight absorption, including spending too much time indoors, e.g. office jobs, remote work. Overuse of sunscreen, which blocks vitamin D synthesis. Living in northern latitudes, areas with less sunlight exposure during winter months. Wearing clothing that covers most of the body, common in certain religious or cultural practices. Aim for 15 to 30 minutes of direct sunlight exposure on the skin, arms, legs, or face at least a few times per week. Second, dark skin pigmentation. People with darker skin tones have higher levels of melanin, which naturally protects against UV damage. However, melanin also reduces the skin's ability to produce vitamin D, putting individuals at a higher risk of deficiency. People with darker skin may need more sun exposure or higher dietary vitamin D intake to compensate for lower synthesis rates. 3. Poor dietary intake. While some foods naturally contain vitamin D, diet alone is often not enough to meet daily requirements, especially for people who do not eat fatty fish, salmon, mackerel, tuna, egg yolks, fortified dairy products, cheese. Consider fortified foods or vitamin D supplements if you have dietary restrictions. 4. Aging and reduced skin synthesis. Older adults are at a greater risk of vitamin D deficiency because skin loses its ability to synthesize vitamin D effectively with age. Calcium absorption declines, increasing the risk of osteoporosis and fractures. Limited mobility may reduce time spent outdoors. Aging individuals should monitor their vitamin D levels and consider supplements if needed. If you suspect you have low vitamin D levels, you can confirm it through a simple blood test called the 25-hydroxyvitamin D test. This test measures the amount of vitamin D in your bloodstream and helps determine whether you need dietary adjustments or supplementation. Recommended vitamin D levels: sufficient, 30 to 50 nanograms per milliliter. Deficient, below 20 nanograms per milliliter. Severely deficient, below 10 nanograms per milliliter. If you experience any of the symptoms mentioned earlier, such as fatigue, bone pain, muscle weakness, or frequent illness, it may be time to get your vitamin D levels tested. Vitamin D is an essential nutrient that plays a vital role in bone strength, immune function, muscle health, and even mental well-being. Deficiency can lead to various health problems, ranging from fatigue and mood swings to brittle bones and weakened immunity. How to maintain optimal vitamin D levels. Get regular sun exposure. Eat vitamin D-rich foods. Consider supplements if necessary. Monitor vitamin D levels with blood tests. Are you getting enough vitamin D to keep your body strong and healthy? If you've been experiencing fatigue, muscle weakness, mood swings, or frequent illness, it might be time to check your vitamin D levels. If you found this information helpful, hit the like button and subscribe for more health-related videos. Turn on notifications so you never miss out on our latest wellness updates. We want to hear from you. Have you ever experienced symptoms of vitamin D deficiency? How do you make sure you're getting enough of this essential nutrient? Drop a comment below and let's start the conversation. Your wellness is our priority. Stay informed, stay healthy.